Are you waking up stiff, sore, and exhausted and wondering what's wrong with me? Is it arthritis, fibromyalgia, or something else entirely? Let's clear up the confusion so you can finally get answers and start feeling better. Hello, this is Dr. Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. Whether it's arthritis, inflammation, instability, or pain that just won't go away, my job is to help you understand what's causing it and how we can treat it safely and effectively. Let's get into today's topic. One of the most common concerns I hear from new patients is, I've been told I have fibromyalgia, but could it actually be rheumatoid arthritis? Or the opposite, I have joint pain and fatigue, but all my tests are normal. Do I really have fibromyalgia? It's frustrating, it's confusing, and if you don't have the right diagnosis, you could be on the wrong treatment plan for years. Today, we're breaking down the key differences between rheumatoid arthritis and fibromyalgia, from symptoms to testing the treatment, so you can get clarity and feel confident about your next steps. So what is rheumatoid arthritis? RA, or rheumatoid arthritis, is an autoimmune disease. That means your immune system, which is supposed to protect you, is misfiring. It starts attacking your own joints, mistaking them for invaders. That immune attack causes inflammation in the joint lining called the synovium. Over time, that inflammation can erode cartilage, damage bone, and even affect other organs. RA can be serious. With early diagnosis and proper treatment, we can manage it incredibly well. Typical symptoms include joint pain and swelling, especially in the hands, wrists, and feet, morning stiffness that classically lasts more than 60 minutes, fatigue and low energy. The joint symptoms are usually symmetrical, meaning both sides of the body are affected, and RA often comes on gradually over time, but in some people it hits suddenly with swelling in multiple joints fairly quickly. Fibromyalgia, on the other hand, is different. This is not an autoimmune condition as far as we know. It's a disorder of pain processing, a miscommunication between your nerves and brain that amplifies how your body experiences pain. Think of it like the volume knob on your pain system is turned way up. Your brain is interpreting normal signals as painful. Common symptoms include widespread muscle aches and tenderness, fatigue that does not improve with rest, brain fog and memory issues, or as also called fibrofog, sleep problems, irritable bowel symptoms or migraines, and unlike rheumatoid arthritis, fibromyalgia does not cause inflammation or joint damage, but the pain is still very real. So how are they similar? Both can cause widespread pain. Both can cause fatigue. Both can make you feel stiff, especially first thing in the morning. Both can lead to a feeling of being wiped out from simple daily tasks. But the underlying causes are very different. RA is driven by inflammation and immune dysfunction. Fibromyalgia, on the other hand, is driven by nervous system sensitivity. Let's discuss how we diagnose rheumatoid arthritis. RA is diagnosed based on 4 key pieces of information: your history or your story, your symptoms, and your history of your condition. Physical examination, looking for joint swelling or tenderness, signs of inflammation. Lab tests can be helpful as well. Imaging, especially musculoskeletal ultrasound or MRI, to look for inflammation in the joints. Key labs that we check include the rheumatoid factor and CCP antibody, which are 2 antibodies that are highly consistent with rheumatoid arthritis. The SED rate and the CRP, which are markers of inflammation. The CCP antibody is more specific, meaning a positive result strongly points toward RA. Inflammatory markers like the SED rate and CRP help us track active disease and flares as well. And when it comes to imaging, we often use musculoskeletal ultrasound in my practice because it shows active inflammation in the joints, sometimes even before lab tests do. On the other hand, fibromyalgia is a clinical diagnosis, meaning currently there is no reliable blood test or scan that can confirm it. Instead, we look for widespread pain in all 4 quadrants of the body, lasting at least 3 months. Tender points in the soft tissue, tender points that are very painful with light pressure. Sleep problems with fatigue, that's called non-restorative sleep, which means that even if you've had a full night's sleep, you still feel completely exhausted the next day. And no evidence of joint inflammation or damage on exam or on imaging. We also rule out other conditions like hypothyroidism, low vitamin D, or autoimmune diseases before diagnosing fibromyalgia. This is why it's so important to work with a physician who looks at the full picture and is comfortable dealing with some of the complexity and differences between these diagnoses. So can you have both? Yes, this is actually more common than you think. Some people with rheumatoid arthritis can also develop fibromyalgia. In fact, folks with RA and other autoimmune diseases have higher rates of fibromyalgia than the general population. That means you could have both real inflammatory arthritis and also have a central nervous system sensitization issue happening at the same time. In these cases, joint swelling might be under control, but the pain persists. That's when an experienced rheumatologist with experience in both conditions can help tailor the right approach for you. Some common misunderstandings, let's discuss them. Number one, my labs are normal, so it can't be RA. And this is false. In early rheumatoid arthritis, and even up to 25 to 30% of patients long-term, it's possible to have normal antibody labs. That's why your symptoms, physical exam, and imaging are just as important. Number two, fibromyalgia is not real. That's absolutely false. Fibromyalgia is not just in your head. It's a real neurologic condition and pain condition that affects pain processing. Imaging of the brain shows changes in how pain is interpreted in fibromyalgia patients. Number three, only women get fibromyalgia. It's true that women are more commonly diagnosed, but men can have fibromyalgia too. Because of a stigma and misdiagnosis, many men will actually go undiagnosed. Number four, if my pain is everywhere, it must be fibromyalgia. That's not necessarily true. RA can also cause widespread joint pain, specifically and especially early on. We need to evaluate for swollen joints, your lab markers, and any ultrasound or imaging findings that show inflammation as well. At Chicago Arthritis, I always ask, what's the real reason for your pain? In my clinical framework, chronic pain usually comes from one or more of these root causes. Number one, inflammation, often seen in RA, lupus, and other autoimmune conditions. Number two, instability. When ligaments and supportive tissues are weak or damaged, this can happen after injuries, surgeries, or with aging. This typically will eventually lead to wear and tear arthritis or osteoarthritis. And number three, neurologic sensitization. When your nervous system becomes overly sensitive, like in fibromyalgia or from a pinched nerve, either in one of the extremities or in the spine. By identifying which of these is driving your pain, we can create a treatment plan that's precise and effective. Now let's talk about treatments for each condition. Treating rheumatoid arthritis, the goal is to control inflammation before it damages your joints. Treatment layers may include an anti-inflammatory medication to take as needed, disease-modifying treatments that work to control the immune system, biologic therapies that do an even better job of controlling the immune system, supplements like omega-3, curcumin, glucosamine, vitamin D, and on occasion, regenerative options like platelet-rich plasma or PRP for joint or tendon inflammation. Lifestyle tools are important here as well. Movement, sleep, nutrition are all very key. And we try to avoid treatments that harm tissue like chronic steroids, either oral or injectable steroids. For fibromyalgia, the focus is on calming the nervous system and improving quality of life. Effective strategies include gentle daily exercises like walking or yoga, restorative sleep routines, mind-body practices, meditation, breath work, stress management, supplements like magnesium, CoQ10, or melatonin, and in some cases, nerve-targeting medications such as gabapentin, Lyrica, Cymbalta, and Savella can sometimes help with pain as well. We often use a layered approach based on your symptoms and preferences. There are times when a patient has joint pain without swelling, fatigue and brain fog, negative labs, but still significant discomfort. This is where advanced imaging, like diagnostic ultrasound, makes a difference. It helps to identify subclinical inflammation, the kind that you can't necessarily feel or see easily. And it helps us distinguish between a true inflammatory flare-up or pain driven by fibromyalgia. This helps us avoid unnecessary medications or delays in getting the right care for you. So if you're living with chronic pain, here's what I recommend. Do not self-diagnose. Get evaluated by a specialist who understands both RA and fibromyalgia. Look for a root cause approach. You deserve a plan that treats the cause, not just the symptoms. Ask about musculoskeletal ultrasound. It's a safe, non-invasive way to assess for joint inflammation. Track your symptoms. Use a journal to monitor patterns in pain, sleep, and fatigue. And stay open to a layered treatment plan. You may need both medication and lifestyle tools to get better. To sum up, rheumatoid arthritis and fibromyalgia may look similar on the surface, but under the hood, they're very different conditions. Getting the right diagnosis changes everything. It means faster relief, fewer flares, and a better quality life. You don't have to live in the dark. You don't have to stay in pain. Answers are possible, and treatment is available. If you found this video helpful, please give us a thumbs up, subscribe, and check out our website at chicagoarthritis.com for more expert guidance on staying pain-free and healthy. And if you're interested, contact us to book a consultation. Until next time, have a good day and live well.